I'm Trevor Young, Dean of the University of Toronto's Temerty Faculty of Medicine. In September, we announced a landmark $250 million gift from James and Louise Temerty and the Temerty Foundation. As the largest philanthropic gift in Canadian history, it still takes my breath away. Their donation is an investment in our shared vision of the future, one where we'll champion enhanced discovery and collaboration while also striving for excellence through equity in everything that we do. Throughout this series, we're going to tell you about some of our remarkable research and programs that will advance health and healthcare both here in Canada and around the world. To help guide this conversation, we've got André Picard, our good friend and the award-winning health columnist for the Globe and Mail. André, thank you for making time for us and for all the great work that you do.
Hi, I'm André Picard, and I've just learned how to use the mute button. I'm going to be your host today, your moderator. My day job is health columnist at the Globe and Mail, so us print people struggle with technology a bit, but I'm excited to be here for the first of the Temerty Talks. And it's great to be here with someone who's really shaping the future of healthcare through his work on artificial intelligence. Our featured speaker, as you know, is Mohammed Mamdani. Mohammed's the inaugural director of the Temerty Centre for AI in Research and Medicine here at the University of Toronto. He's a U of T professor, a scientist, a director, and a VP at Unity Health Toronto, which includes St. Michael's Hospital, where he's usually based in non-COVID times. Mohammed has a resume that we could spend the whole hour reading, but I'm going to boil it down very quickly to tell you that he's really a leader in this emerging field of AI. And has a really interesting background that he brings to it. He understands the clinical environment well. He has his first degree in pharmacy. He trained also in health economics, so cost effectiveness is something he understands. And he went on to study statistics and epidemiology at Harvard, one of those universities that's almost as good as the University of Toronto. So he knows his way around big data. Now, Mohammed's vision is all about harnessing the power of data for real-world impact. And he's building at the Temerty Centre with the University of Toronto as the hub for a citywide network of leading hospitals. What he's doing is all about helping doctors and other healthcare providers make better decisions to save lives and to transform patient care for the better. So Mohammed, we're going to give you 15 minutes for your presentation, and I know it's going to be really interesting. Then I'm going to come back with a few questions of my own, and we have many audience questions that have come in, and we'll get to some of those as well. So Mohammed, the virtual stage is yours.
Thank you so much, Andre. It's a pleasure to be here to talk about something that I'm very passionate about, is artificial intelligence in medicine. And I want to start off by explaining what AI is, because you hear all these buzzwords and you kind of wonder, what is this thing? I mean, in very simple terms, AI is the ability for computers to rapidly do things that are just too complicated for us to do, or it would just take us too long to do. And we're enabling computers essentially to act intelligently. And I'd like to argue that AI is already all around us. So if we look at, there we go. AI is already around us. It's all in our lives. And what do I mean by this? Well, I don't know how many of you have shopped on Amazon. Amazon has radically changed how we think about retail business. And it just boggles my mind how it knows what I want to buy next. And you kind of wonder, how does it do that? Well, it kind of looks at people like me in terms of what I bought in the past. And it matches people. There's a person in Utah that seems to be similar to this person here named Mohammed. And there's another person in New Zealand, and there's 400 other people that seem to have similar buying habits. And within seconds, I'm going to analyze things and tell you, Mohammed, what you want to buy next. It's magical how it does that, and it's often right. Another example that I think all of us really deal with are these pieces of metal here. And for iPhone users, you've got Siri. For Android users, you've got Google Assistant. I find it fascinating how I can ask it practically any question, and this piece of metal within seconds will be able to give me an answer. Sure, it's a love-hate relationship, and it may end you, and you may end up in a lake with some directions at some point. But by and large, these things work reasonably well, and it's coming to healthcare. Healthcare seems to be a very conservative sector, I guess you could say, but we're very, very data rich. And I think we are going to be dealing with AI, whether we like it or not. But there are some challenges. What are the things that drive AI? How does this AI thing work? Well, there's three things that I'm going to touch on that really are needed, and some challenges around these three things. The first is data. The second is infrastructure. How do you process that data really quickly? And the third are rules. So if we look at data, I'm going to use the example in Thailand. In Thailand, over 30% of patients with diabetes have problems with their vision. They have low vision or they're blind. That's a high number. So screening for eye defects or anomalies is very, very important. So diabetic retinopathy is what we call it. How do you do that in a mass scale? Well, Google came up with this algorithm that was absolutely fantastic. It actually was able to detect anomalies in an eye very, very rapidly, within seconds, at the rate that an ophthalmologist would detect it. Now, of course, the problem here is they trained it on very ideal images. In the real world, when they actually deployed it in Thailand, it didn't work out so well. Because what happens in the real world is you don't have ideal images. You have images that are subjected to poor light quality, and about 20% or so are just off. Sure, the trained ophthalmologist can read it, and radiologists can, but AI images or AI algorithms often get fooled. So it didn't work out quite well. So I think it's really important for AI algorithms to really focus on data, messy real world data that really can be applied to clinical practice versus lab ideal data sets that AI algorithms are often trained on, and then they fall apart in the real world. The second thing is going to be around infrastructure. The example I want to use here is IBM Watson. So I don't know if people have heard about this thing, but basically IBM created this supercomputer, which is incredibly good at reading tons and tons of things. So for example, in oncology, two hospitals in particular, MD Anderson and Memorial Sloan Kettering in New York, they had actually tried to use IBM Watson. And what they did was something very simple. IBM Watson would say, oh, you have this patient. This patient is 72 years old. They have this condition, and this is the type of cancer they have. And literally within seconds, it would read through hundreds, if not thousands of articles in the medical literature and say, this is what I recommend. Now, in theory, that sounds wonderful. The reality is, it would often give advice that clinicians would really scratch their heads around and say, that's not really helpful to me, or I don't think it's really got it right. And so while the infrastructure is there to rapidly process things, I think where we may have had challenges is knowing what information doctors need to actually make decisions and when they need it. Now, the third part is rules. This is something we often don't think about. But the reality is, the running joke is that the state of AI nowadays, the intellect level is that of an 8-year-old. And I know that doesn't sound very impressive. And now you're thinking, you're making a big deal out of an 8-year-old. Well, I'll tell you why this 8-year-old is impressive. The 8-year-old's impressive because it never forgets anything. And that is incredibly powerful. The problem with 8-year-olds, though, is they're very impressionable. They learn. And they often need rules and help to learn. What are they going to learn? Oftentimes, they'll learn on their own, or they'll learn what we teach them. And in fact, in 2016, Microsoft released a chatbot called Tay. Now, the thought here was, Tay is a conversational chatbot, and it will actually be able to communicate with humans, but it will learn how to talk with humans from humans, and it will be fantastic at conversing. Unfortunately, what had happened is Microsoft had released Tay to the Twitter universe. And of course, humans came in, saw Tay, and taught it to be racist and misogynistic within 24 hours. Microsoft had to pull Tay from the public environment because they didn't want a chatbot who learned all of our bad habits. In the United States, in Science, there was an article published on algorithms that are being used in US hospitals that actually disadvantage Black patients from getting the resources that they need. And it's not that the algorithms are bad, it's just the algorithms learn what we as humans do, and they perpetuate our mistakes. So certainly there are challenges in having strong ethical frameworks and having them applied to AI algorithms. And of course, that requires often patient input. Now, of course, I've told you about some of the successes. We've got phones, we've got Amazon, but I'm also telling you about a lot of the failures and challenges. And so it's not very straightforward to say we're going to conquer the world with AI. But I firmly believe we can. And I'll tell you why. At the University of Toronto, there are a few places in the world that have the expertise in the ecosystem that we do. The Department of Statistics, that's pretty core. Statistics and math is fundamental to AI. We're ranked among the top 10 in the world. Same with our Department of Computer Science, among the top 10 in the world. Now, engineering, we're in the top 25 in the world. Our education, top 5 in the world. Our medical school, top 5 in the world. We have an incredible amount of skill set here, technical and context, that are among the top in the world that are in one place. We also have the Vector Institute, which is one of the top artificial intelligence institutes in the world, right here in Toronto. Now, that's where a lot of people stop and they say, all right, well, you got all the fancy math and you've got the vector and you've got docs who want to do research. But I got to say, our other core advantage is we have a very, very large hospital network, the Toronto Academic Health Science Network, which spans the University of Toronto and affiliated academic hospitals. And that is incredibly powerful if you now start coupling our natural lab here with all sorts of patients and doctors and nurses and mathematicians and engineers. And you can tell I'm getting very excited. It is a very exciting environment to be in, to be leaders, not just in Toronto, not just in Canada, but certainly in the world in this space. And I can tell you, we're already headed there. I'm going to give you some examples of not things that we dream about, but things are actually happening. You just have to go as far as sick kids. At sick kids, we've created algorithms. They have something really interesting there that actually detects pediatric heart attacks, up to 70% of them minutes in advance. So kids in the ICU, they're pretty vulnerable. Every second counts. And so if you can actually predict heart attacks happening well before they do, that's going to save lives. If we now go to Princess Margaret Hospital, part of the University Health Network, UHN, and we look at prostate cancer, about 40% of patients or so require radiation treatment. And these treatment plans are complicated because you want to be able to target radiation. You don't want it to go beyond the target organ. It can take a team of specialists hours, if not days, to create these treatment plans. Well, the folks at Princess Margaret Hospital have developed an AI algorithm that can do this within minutes. And what they've been able to show is that the success of their treatment plan, this AI can develop treatment plans just as well as a clinical team, if not better, 88% of the time. In my own place, we've done something for our internal medicine patients. So the largest service at any hospital to admit patients is the general internal medicine unit. And 1 out of 12 patients roughly will die or they'll go to the ICU. And a lot of times we don't know why. And by the time we realize a patient is crashing, on average, we have 3 hours to react. And that is not a lot of time. So what we did was we created an early warning system. This thing is not, it's not fictional. If you go to our hospital at St. Michael's now, you will be monitored by AI if you are in our internal medicine unit. It is happening as we speak. This AI algorithm every hour grabs data from all of our systems. And it considers over 100 variables between 500 to 800 different permutations and combinations. And it will tell you at least 24 hours in advance if a patient is going to die or go to the ICU. And it does this with well above, with much higher performance than our clinicians. In fact, we review these cases quite a bit. And just one of our recent cases, I'm just going to read you a note of something that actually happened. The resident on call overnight received a high-risk alert around 11 p.m. She went in and reviewed the chart and saw the patient as per recommended protocol. He was relatively stable. But approximately 2 hours later, she received a call from the nurse that the patient was decompensating. As she already knew the patient, she had a sense of what was happening. She was able to call the ICU team to get involved. The patient went to the ICU, but thankfully did not have a respiratory arrest, which was certainly a risk if the intervention had not been done as quickly. So I'm actually going to go now to talking a little bit about how we can bring a lot of this together, because the examples I'm giving you at Princess Margaret, at Sick Kids, at St. Michael's and Unity Health Toronto, we're all working somewhat in isolation. And it's really through the generosity of donors like the Temerty family that we're able to now have a concerted approach to say, we should probably be working together to make it even more powerful. So we've created a center now, the Temerty Centre for Artificial Intelligence Research and Education Medicine, or TCARM, with three basic foundations. The first is education. Now, there's not a lot that we know about education, but what we do know is there's a survey in South Korea, for example, that suggests that about 6% of physicians actually feel very comfortable and confident about AI. A lot of us don't know much about it. So we're going to have world-class education programs to train our physicians about AI. Research. We're going to take a very progressive approach to research here. We're not going to be about the conservative, play it safe type of research initiatives. We want high risk, high reward. The transformational type of research that will have a chance to change practice as we know it. Those are the sorts of things we want to promote in our research arm. And of course, infrastructure. We're very, very, very fortunate to have two leaders who I have incredible respect for, who are really dedicated to creating a research environment that is going to be amenable to our researchers, that will enable and empower them to be able to do research that is absolutely cutting edge in a way that we haven't really done before. But, you know, we talk a lot about these sorts of things, and I got to say, people stop at, well, let's buy the biggest server, or let's bring in the world's greatest data scientists. The one thing, if I had to pick, that I'm most excited about is none of those. What I'm most excited about is community. How do we bridge the data scientist with the pediatrician, with the ethicist, with the artist, to be able to create things that are just so novel and unique that can fundamentally change how we practice medicine? How can we bring these people to work together that will drive not only our community, but fundamental culture change that is absolutely needed in healthcare to enable AI to make a difference? And you may ask, why? Why would these people get together? Well, I think now we have a center to bring people together. But I think it all boils down to our common purpose. And I think all of us will agree that our common goal, whether we be mathematicians or doctors or administrators in this area in medicine, is really to have better care for all of us. And I think that is really going to lead to our success. So thank you. And at this point, I'll end my talk here.
Wow. Thank you, Mohammed. Super interesting, lots there to digest and think about. I've learned to use AI while you were talking. I said, Siri, can you unmute me? And it magically happened. I didn't have the problems I had at the outset. So we're already making progress. So I have a few questions of my own, and I have, as I mentioned, a lot of audience questions came in. So I'm going to toss them at you and see what we think. So I was very interested, your presentation, it's all very futuristic. AI is really fascinating. It's the future, but we still live in this world in Canadian healthcare where we have fax machines. That's our everyday standard. So how do we figure out how to get this interesting stuff into this very conservative culture?
That's a great question. I think we have to get from facts to future. And it is absolutely true that I've got to believe we're one of the few sectors that relies so heavily on facts, and it drives me crazy. Now, of course, when you talk to people who use the fax machines, the reason why they use it is because it works. And that's kind of what they're used to doing. Now, when you boil down to it, the AI isn't going to fix that problem. It's going to be that individual who says, no, I'm ready. I'm prepared to actually embrace something different. And that's where I keep going back to that slide around community. I fundamentally believe that for AI to succeed, it's just as much about people, if not more, about people and social and community than it is about building the complex mathematical algorithms. And where I think people get excited and build that community is if they can see that something is going to make a difference for them and for their patients. So for example, the models that we typically use at our center is that the AI projects are not driven by our data scientists. They're driven by the clinicians. And if they feel they're involved, they're engaged, they're genuinely getting benefit out of it, they're going to want to change and be part of that movement. And I think it's just going to be the same for people who are used to using rudimentary tools. When they see the value of what can be, I think that'll be the catalyst for large scale change.
So I'm hearing, medicine is about people ultimately, and you're saying that AI is just another tool, a better tool than a fax machine.
It is considerably better than the fax machine, in my humble opinion. But absolutely, AI can only give you information, and certainly we can automate things and whatnot. But if the clinician at the end of the day is not willing to use that information, then it's not going to be very helpful.
Now, you know the expression garbage in, garbage out. How do we ensure that we have the data that will make AI useful? Because we have tons of data, we don't necessarily make good use of it now. How will we fix that fundamental problem?
We have a long way to go. This is for anyone who thinks AI is going to solve our problems tomorrow. I think they're sadly mistaken. That being said, we're making massive strides now. Data is very much a team sport, and it's, I would say, more about the people who want to fix the data than it is about the technology to enable us to do it. So we need to get people around the table to see the value of the data and to be able to make sure that we have good, clean data coming in. And I'll give you an example. We were working with our vascular surgeons, and we have a really phenomenal vascular surgeon in our hospital who's very interested in understanding, well, how do I understand the quality of the patients that I'm providing for my patients? So for example, I want to know how many patients are leaving the hospital with a high blood glucose level. And I have 17 other quality metrics that I want to know. And we said, okay, great. Let's try and get at that data. And some of the data, we have to build machine learning algorithms to rip through dictations and text notes to figure out what's happening. And we have some pretty sophisticated machine learning algorithms to do that. But what we realized is that the doctors were talking very differently in their dictated notes. One would say X, the other would say Y. There was no standardization. And so we told the surgeon, if you really want this information, you've got to tell people to start talking the same way so the algorithms don't get confused. Within a week, because it was important to him, the entire division changed how they dictated because they thought it was very valuable for that information to come across. And that fixed the problem. And now we have our algorithms that are able to read through it very efficiently and give them reliable estimates. It's going to take that buy-in and that culture change, the community, to be able to give us that data that we need to enable AI.
Now, talking about culture, in Canada, we have this culture of free medicine, public health care. Some people worry, AI is really being embraced by the private sector. So some people are worrying in our questions, is this a threat to Medicare? Things like Babylon are being brought in, and that's very much a private sector initiative. Should we worry about that aspect?
Yeah, it's a great question, and I think there's going to be forces on both sides. I would say that we need to stick with the common principle of helping patients. Of course, the foundations of our healthcare system is not so much for privatization. Privatization does fill some needs, I think, for some people, but I would say that there's going to be advancement in both areas. As long as our principles aren't compromised, we have the system that works for our people. There'll always be ways to figure out how the two groups can work together.
As I was going through, we got more than 100 questions from participants. I was going through them. There's a real mixture of excitement and a lot of fear. And one of the questions that came up the most often is this a threat to medicine? Is it going to make me lose my job? And I have to say, in particular, radiologists are worried about this. So is this a threat to people's work?
Yeah, it's also a very interesting question. I get that question all the time. We actually, for example, there's another example where we're just about to launch another solution, which is a platform that as soon as a CT scan of the head is done, it grabs the CT and the AI algorithm looks at it and says, "Yep, you have an intracranial hemorrhage. Here's a subtype, and here's exactly where it's located." And that would scare a lot of people because it does this very quickly, within seconds to minutes. And the average turnaround time for a radiologist to detect intracranial hemorrhage is over 3 hours. So if you can cut that down to minutes, some radiologists will say, whoa, is that going to put me out of a job? I would say, no, I think it should be used with the radiologist to say, okay, you know what, this is alerting me to look at this image and I'm just going to make sure that it read it right. But there's also all sorts of nuances that it hasn't learned that I can then be more effective at helping it. So I view this as largely, at least in the near future, a very symbiotic relationship between AI and clinicians. Now, there will be some things that I think can be fully automated and that will release time from clinicians from doing mundane things, but I don't think it will actually replace the physician.
Now, we've been told, though, from time immemorial that technology is going to free us up to have more time, have more leisure, but we've become prisoners of, the internet and stuff. Is it going to be the same false hope with AI?
Well, I hope not. I do think, I think most clinicians will agree with me. We have a lot to do. There's no shortage of time, and there's always things that we could be doing better if we only had a bit more time. We could spend more time with patients. We could actually learn a lot more to be better clinicians. I generally think that AI will enable us to have a bit more time. It won't solve all of our time problems, but it'll take care of the things that really we probably shouldn't be doing because number one, we're either not good at it, or number two, it's probably not a great use of our time. And then we can focus on things that actually matter to patients and patient care.
Yeah, and a machine doesn't matter. It doesn't care if it's repeating tedious things over and over. So it's good to take that out of our lives.
Absolutely. Absolutely.
Now, the other theme that's really coming through, and you talked about this in your presentation, is about the whole equity piece. How do we make sure that it's not racist, that it's not sexist, that how especially that the biases that we have now aren't built in and perpetuated? That seems like a real challenge.
It's incredibly important, foundational, I would argue, and it is what's going to make us better because the AI algorithms will learn our biases, our prejudices, whether we know it or not. There are prejudices and biases that exist. Now, we have the opportunity to say to the AI algorithm, I'm going to actually make sure that you're not having these biases. There's whole areas of research, scholars in the field who have actually dedicated their careers to studying how we can actually make AI algorithms more fair and equitable. In fact, there are champions here in Toronto that are internationally renowned for this sort of work. So there are ways where we can actually check for these biases, racial, gender, all sorts of biases. And there are mechanisms to help actually minimize those sorts of biases. And that's what we try to actively do with the algorithms that we create. And certainly will be one of the things in our center that we will be looking at very aggressively around fairness and equity.
Now, we haven't done a good job about minimizing those in people. Can we do it better with machines?
I believe we can, because the problem that we have oftentimes is that there certainly are people who will intentionally actually have biases. But a lot of us have subconscious biases that we're biased without even knowing it. At least with machines, we can try and detect these biases and fix them more systematically so that they don't make the mistakes to the level that we do as humans.
Now, you mentioned in your talk, I thought this was a bit troubling, that only 6% of clinicians are comfortable with AI as it stands. So there was actually a lot of interest from students, clinicians, researchers saying, how can I get up to speed? How can I learn about this stuff so I'm not scared about it anymore?
Yeah, it's a huge area. Education is extremely important to me personally. But I do think we have an incredible task because there are all sorts of myths around AI. And I think we need to be able to combat those myths. The other thing that I think becomes really important is, especially in the medical area, we have busy clinicians who don't have a lot of time, who don't often know where to go and don't know how to learn about these things. And because we've created a center that really is relevant to medicine, we understand our clinicians, we'll be able to develop tailored programs that are not only time efficient, but also very effective in communicating exactly what AI is and what clinicians really need to know at the end of the day so they can be much more informed and effective at using these technologies to provide the best possible care.
And what are a couple of those myths that you'd like to debunk?
Yeah, I think one of the myths is that AI just magically happens and we can solve any problem with AI. I think at the very foundational level, I think you had alluded to it, Andre, very, very insightfully. It's about data. You can't have AI in a lot of cases without data. So it is a whole process of getting the data infrastructure right. and then that enabling AI. And the second big myth is around related to answering any question, is that we have to be very, very careful about what questions it can answer. Because there are things where you don't want to use AI because it's not going to help you much. How do you really strategically pick the right questions, understanding the capabilities of AI, and enable the right data to be able to feed into those questions to get the answers from the AI algorithms? That's a whole process and learning in and of itself. And the more we learn about AI and its capabilities, the smarter questions we can ask and the better data we can drive to feed into these algorithms.
And can AI itself do the data collection job? You know, a lot of that again is tedious. The data entry, we still have data entry clerks in this century. Can the machines do that stuff that we do badly?
Yeah, there's a lot more movement in this space, and I'm pretty optimistic. So, and on two levels. First of all, for example, we've got things like Apple Watches, right? I mean, I'm wearing an Android watch, but this thing will actually regularly monitor your heart rate. It will monitor all sorts of other parameters, so you don't have to enter that data. And it does a pretty decent job of it. And it can then actually analyze that data to tell you if there's something wrong. So you can have automated ways of collecting data, but that you can actually efficiently analyze that data as well without us really knowing. The other thing that I wanted to highlight here is what's incredibly fascinating is that we have these what are called unsupervised learning approaches and other kind of creative learning approaches where the machines end up teaching themselves. So, and they teach themselves how to be creative. For example, there are now AI algorithms where the computers will write poetry themselves. There's a movie clip that without any script, without anything, the computer just created a clip of a movie on its own. Incredibly powerful. Some people may say, whoa, that's a bit scary, but we're really getting more and more advanced in this space of computers automating things, not only in terms of data collection, but also what to do with the data to produce something that's valuable.
Yeah, and in my business, we have bots who can now write stories. They can write sports scores because it's very formulaic. So that's kind of creepy. And I want to delve into that creepy part of it. You know, when you're talking, giving your presentation, I had in the back of my mind the voice of HAL, in 2001, The Space Odyssey, that computer that kind of went rogue. And people worry about that. When you say they can teach themselves things, do we worry that they're going to teach themselves bad things and hurt us?
There are very large camps around this. Some camps believe, no, don't worry about it. We've got the principles sound and it'll be okay. Then there are other camps who say, no, these things are going to basically destroy the world. I'm somewhere in between. I do think that these systems and these algorithms that we're creating are incredibly powerful. In fact, there was a hotel chain in Japan which had these robots at the check-in desk. So it's not a human that checks you in, it's a robot. And the cameras were trained to actually look at your facial expressions and see, does this patient have jet lag? Did they got off a really long flight? Maybe I shouldn't do a lot of chit chat and just give them the key. Or do they want to engage in conversations? Are they feeling happy? They can actually try and detect emotion. And we get to a point where do they detect emotion on themselves and then react accordingly? It's a route that we'll have to watch and see how it develops. This is why I think the concept of rules and frameworks are so important for these algorithms so that we don't spin out of control.
And there's been some great Hollywood movies on that premise of the machine becoming a little too human for our own good. But I wonder that, can we explore that a bit more? Because, in medicine, empathy, compassion, these are key characteristics of a clinician. Can we teach those to a robot, to a bot?
There are many groups all around the world that are working on it as we speak. Empathy in AI is a huge topic. And I have to say, there's been some impressive movements in some spaces. Now, in other spaces, of course, it's tempered. I still think we've got a long ways to go, but I have been pretty impressed with what I've read and what I've seen around these bots in Japan, for example, that are actually interacting with humans. It's almost scary how they can actually detect if you're sad or happy and then can emulate a calming response or a more stern response depending on how they interact with people. I think we're going to make progress in this space.
I know I went to Japan and I saw some amazing, like in care homes, robotic pets, robotic care providers, and it is fascinating, but it's creepy at the same time. I don't know how we get. Maybe it just takes getting used to because it's something new.
It's a new environment. It's going to be a new normal. Just, I kind of reflect too, and sometimes you need these revolutions rather than evolutions. The pandemic, for example, is nothing that anybody really expected, and it's had such a profound revolutionary impact on how we think about things. I think AI is going to be a little bit more evolutionary, but these kind of more scary thoughts around AI will take a little bit of time for us to adjust to and socialize to. But I also find that if there's an economic argument, those will be pushed a lot harder.
And there's a lot of interest in that evolutionary part of what you said. People are wondering, I'm a physician. What's my job going to look like in 5 or 10 years? Can you gaze into the crystal ball and give us a sense of that? Maybe to frighten people more or calm them. I'm not sure which.
That's $1 million question. I firmly believe that I think 5 to 10 years is a pretty short amount of time. And my sense is we're going to see some evolutionary changes, nothing radical. I know in Toronto, we're a hotbed for this sort of stuff. I think we have incredibly great hospitals all the way west at Trillium to out east. We've got some incredible hospitals that are working on a lot of this sort of stuff. I think we're going to see more and more of these AI tools being deployed in hospitals. Not radical changes, but it will evolve in, let's say, 10 years to a point where clinicians, we will likely have the AI algorithms reading some of our images in the radiology suite. And we will have AI algorithms monitoring our patients and telling us when somebody's going to crash. I see that happening in the next 10 years. It's already happening in our hospital and several other places. So it's not a dream. I think to see radical changes where we have patients literally interacting with bots as doctors, that I'm not sure when or if we'll see. I do think there's a massive role for doctors, but that's what we'll evolve to maybe 20, 30, 40 years down the road when society's more comfortable with it and doctors are more comfortable with it as their roles evolve.
But maybe if not the bot doctor, maybe the bot receptionist at the hospital or something.
Yeah,
All kinds of things.
absolutely. And then of course you'll get people panicking about different types of jobs. But I would go to argue that what we have to embrace is we are now in a learning society. And roles that are rote, that are mundane, that people are very happy with, I have to worry because I do want people to really think I am in a learning environment. This is a new norm that will constantly have to learn about things. And anything that can be repeated, anything that is mundane, maybe AI or robots or whatever have you should be doing that sort of work.
Now, you mentioned hospitals. Toronto has great hospitals, and there's one of the questions is about this. What about smaller hospitals, less resourced to parts of the world? Are they just going to be left behind by this fancy new technology?
I certainly hope not. I would say that at least currently, there is a requirement for quite a bit of infrastructure and resource to be able to develop and deploy AI solutions. I think that's going to change though. I think increasingly what we're going to see is, hey, hospitals, you have data. I know you're small, but maybe you don't have the resources. But if you actually deploy your data into a central place, we have whole teams of people that'll work on it and be able to deliver solutions to you. We're going to see more of that. For example, we have, again, at our hospital, and I'm sorry to bombard you with our hospital's solutions, but that's what I know best. We have a tool where it updates regularly and it predicts how many patients are going to come to the emergency department. So this thing grabs 3 years of historical data from the emergency department. It grabs weather data. So is there a snowstorm tomorrow night? It grabs city planning data. Are the Raptors playing at the Scotiabank Arena tomorrow? Is there a marathon happening on Lakeshore Boulevard on Sunday? It grabs all this data and it actually tells you, today's Thursday. Tomorrow, Friday, from noon to 6, we'll have 82 patients in the emerge. 10 of them will have mental health issues. 12 of them will be high acuity, and the rest will be lower acuity. And it does this with between 94 to 96% accuracy. And that just helps us plan and staff better. We've actually deployed this at 4 other hospitals. And the one, and I don't know if I'm able to say this, but we're actually working with a hospital in the Sioux right now to deploy it there. So I think these tools they have to be deployable for the greater good. That's really what we want. It's not just for our patients, but for all patients.
Now, we can't talk about healthcare without talking about money. It consumes a big part of our public budgets. Will AI save money? That's always a big question.
I fundamentally believe it will, but it will require significant investment to get there. And again, another case in point, sorry to belabor you with more examples at our center, things like nurse staffing, for example. A lot of hospitals, we have a core base of nurses, but they get deployed to different units, but they sometimes call in sick. They go on vacation, mat leave, pat leave. Whenever a nurse leaves, you've got to replace them. So either you pay another nurse overtime, or you actually call up an external agency and pay them an incredible amount of money to fill that spot. Well, there's this whole concept of nurse resource teams where there's a small group of nurses that just get deployed to relieve these folks. How big do you make that team? At our hospital, we've used optimization and AI algorithms to actually help determine how big that pool should be. And using AI, it's deployed in 2 hospitals with an estimated annual cost reduction of over $1 million a year. It didn't take long to develop them, a couple of months. That's a pretty good return on investment.
And the fundamental of AI is you pump data in and you learn from it constantly. So theoretically, it should save us from doing all kinds of unnecessary surgery, et cetera. It should save money, ideally.
I would think so. There's lots that we can optimize. In fact, there was one study that suggested that the inefficiency just around scheduling with operating times, because it is complicated, is in the neighborhood of 20%. That's a lot of resource that could be saved and could make us a lot more efficient. And there are a lot of AI solutions that could tackle that problem fairly well. And to your point around looking at patterns, to go back to this nursing example, when we looked at when nurses called in sick or went on vacation, it was magical how you saw these blips in data around, it's Valentine's Day. I wonder why so many people are calling in sick, or Mother's Day, or Halloween. There are patterns that can be leveraged to make our systems more efficient.
We're almost out of time, but I want to ask you one last, again, a forward-looking question. We hear data is the new gold, right? Everything's about data. Do we have to worry about who owns the gold, who owns the data? Is that a fundamental part of this going forward as well?
Yeah, absolutely. As much as I'm optimistic and like to be positive thinking, there are good players and there are bad players. And we want to make sure that we protect against the bad players. So I do think there's all sorts of rules and legislation and whatnot that are very warranted. That being said, I think we go overboard, and we want also to have a lot of good qualified people accessing data to enable AI. So there has to be that right balance. I'm not sure that we've hit it yet. This will continue to be a big area of exploration and growth, where there are actually boutique firms now in law that are focused on AI and data. We'll see more of that, but I think it'll help us to get closer around how do we manage that data, who gets access, and maybe who shouldn't get access in a very fair, equitable way that'll advance the field and benefit society.
But shouldn't it ultimately be the individual? Doesn't it belong to me, my genome, all the data that flows from it?
Absolutely. And a fundamental part to developing all of this is engagement from the public and from patients. And that can't be emphasized enough, that at the end of the day, the people who are generating the data should have a huge say in what happens to their data.
Well, great note to end on. I think a fairly positive one, and one that makes us think. So I want to thank you. I could ask you questions for another hour. It's a fascinating topic, but I want to thank you, Dr. Mohammed Mamdani, for joining us today, sharing your expertise, your very thoughtful answers. And I want to thank everyone who joined us virtually today. We had more than 1,300 people registered for this event, and more than 100 questions. I only got to a few of them, but I tried to touch on the big topics. So again, thank you. It shows, I think, speaks to the interest in this topic and how it's going to be with us for a while. So this session was recorded, and it'll be shared with everyone who registered via email, and it'll be available for others to watch who didn't have the pleasure of being here live. And don't forget that today is just the first of 3 new Temerty Medicine Talks. Watch for invitations in your email to future events. And the next one is going to be a November session centered on, of course, the COVID-19 pandemic. So watch for that November 20th. We'll have a lot to talk about then. And until then, again, thank you for joining us, and until next time.